Throughout history, pandemics have caused widespread illness, death, and social and economic upheaval. From the Bubonic Plague in the 14th century to Cholera Pandemic in the 18th century, pandemics have repeatedly challenged human societies. By examining the causes and fatality rates of these pandemics, we can gain a better understanding of how infectious diseases spread and how societies respond to them. As we face new challenges in the 21st century, the lessons of the past can help us to better prepare for the future. The cholera pandemic of 1899, caused by the bacterium Vibrio cholerae, claimed over 1 million lives worldwide. It was spread through contaminated water and food and caused severe dehydration and diarrhea. The pandemic had a significant impact on global public health, leading to the development of new sanitation and hygiene practices. It also highlighted the importance of international cooperation in fighting infectious diseases, with organizations like the International Red Cross playing a crucial role. The pandemic eventually ended in the early 20th century. The 1968 flu pandemic, also known as the Hong Kong flu, is estimated to have caused up to 1 million deaths worldwide. The virus spread rapidly due to increased global travel and urbanization. The pandemic disproportionately affected young adults, with a higher mortality rate in people aged 15 to 34 compared to other age groups. The H3N2 strain of the virus continues to circulate as a seasonal flu, with regular updates to the vaccine to protect against it. The 1889 flu pandemic, also known as the Russian flu, is estimated to have caused 1 million deaths worldwide. The pandemic spread quickly due to increasing international travel and poor public health infrastructure. The H3N8 strain of the virus caused severe respiratory illness and pneumonia, particularly in vulnerable populations such as the elderly and young children. The pandemic also had economic consequences, with businesses and transportation systems disrupted due to widespread illness. The cholera pandemic of 1852, caused by the bacterium Vibrio cholerae, resulted in the deaths of an estimated 1 million people worldwide. The disease was spread through contaminated water and food and caused severe dehydration and diarrhea. The pandemic had significant social and political impacts as it led to improved sanitation and hygiene practices and sparked debates on public health policy and government intervention. The pandemic eventually subsided in the late 1800s due to improved public health measures and medical treatment. The Asian flu of 1957 had a global impact with an estimated 1 to 2 million deaths worldwide. The H2N2 strain was highly contagious and caused severe respiratory illness, leading to increased hospitalizations and deaths among high-risk groups. The pandemic also had economic consequences as businesses and schools closed to prevent the spread of the disease. However, the development of a vaccine and improved surveillance and containment measures helped to control the outbreak by 1958. The Antonine Plague of 165 AD, also referred to as the Plague of Galen, an ancient pandemic that affected the Roman Empire, is believed to have been caused by smallpox. It spread throughout the empire between 165 and 180 AD, possibly brought back by troops returning from military campaigns in East Asia. The disease quickly spread throughout Europe and the Mediterranean, claiming countless lives, including that of the Roman Emperor Lucius Verus. Greek physician records describe common symptoms such as fever, diarrhea, pharyngitis, and pustular skin eruptions that appeared by the 9th day of infection. The plague of Justinian, caused by the bacterium Yersinia pestis, resulted in one of the deadliest pandemics in recorded history, estimated to have killed between 25 and 50 million people across Europe, Asia, and Africa during the 6th and 8th centuries AD. The plague had a profound impact on the world. Moreover, the plague of Justinian paved the way for the later outbreaks of the Black Death during the 14th century, which had a similarly devastating impact on the world population. The Spanish flu of 1918, caused by an H1N1 virus with genes of avian origin, is considered one of the deadliest pandemics in history. The disease first emerged in the U.S. during the spring of 1918 and quickly spread worldwide via the massive mobilization efforts of World War I. By the time the pandemic subsided in 1919, nearly a third of the world's population had been infected, with an estimated 500 million cases and between 50 to 100 million deaths. Human immunodeficiency virus, HIV, is a viral infection that weakens the immune system and makes it difficult for the body to fight infections. It was first identified in 1981 and has since spread to pandemic levels, affecting more than 75 million people globally. Despite advances in treatment, no cure for HIV exists, but antiviral medications can control the virus and its symptoms, prolonging the onset of AIDS. Infection rates have remained stable for several decades, with sub-Saharan Africa having the highest rates. The Black Death, also called the Black Plague or Bubonic Plague, was a catastrophic pandemic that spread across Eurasia from 1346 to 1353. It is caused by the bacterium Yersinia pestis, likely originating in Central Asia and transmitted by fleas and rats. Contrary to popular belief, similar plagues occurred in earlier centuries, such as the Justinian Plague of 542 AD, which killed over 25 million. Its impact on history continues to be studied today. There you have it. We hope you liked our video about 10 deadliest pandemics in history, and if you want more videos like this, please go see our channel and subscribe to see our lineup of interesting topics. Thanks for watching.